All right, so we're going to set up now for the surgical procedure for Autumn's spey. It is really important to remember that in a surgical theatre we must maintain asepsis. What that means is everything that comes into this room basically has to be wiped down with chlorhexidine before the procedure. So the bubble wrap that I've got here, which I'm going to use to insulate this cold table, has already been wiped over with chlorhexidine and alcohol and allowed to dry. The reason we do that is that we don't want to introduce any pathogens into the surgical suite, but we also can't use towels, and we somehow need to maintain a bit of insulation from this cold table to the patient. So instead of using towels, we wipe down bubble wrap, and we use bubble wrap as a little bit of a barrier so that the coldness from this surgical steel table doesn't come up through to the patient. So I'm just going to lay these out flat. I've got a nice thick piece of bubble wrap underneath, so that should really help us try and provide a nice little barrier for the patient. This is a vacuum mat. The way that we use this mat is we put a little bit of weight on the mat, like we would if the cat was going to be laying here, and then we use this little suction device and we actually remove the air out of the mat. And what this does is provides a nice trough for the cat, which isn't cold. So we don't have to use the cold steel table, and we don't have to use the cold V-trays for the whole procedure. We can use this little insulated mat, and it actually keeps the heat in quite nicely. So while we're waiting for the patient, I'm actually going to leave the heating there, and that'll just provide a little bit of extra warmth during the surgery procedure. The cat will lose heat very quickly from the time she's pre-medded. Basically, all of the medications that we use to either pre-med, induce or maintain the animal will work towards lowering her body temperature through the process of vasodilation. So what we need to do is try and reverse that as much as possible. So we've got our bubble wrap, we've got our little insulated padded mat here, I've got some warm water bottles here, preheating the area. And the last thing I'm going to do is I'm going to set up this warm air blanket. Now the warm air blanket will basically just circulate around the patient during the surgery procedure, and that will allow us to provide external heating as well as internal heating, which she will receive through the heated breathing circuit during the procedure. So it's really important to consider how you will maintain your patient's body temperature prior to anaesthetising them. What we want to do is be proactive, not reactive, when it comes to things like hypothermia. All right, so I've got my warm air blanket hose in place. I've tied it around my blanket. Now I can just turn this on. And you can see it fills up with air. So, if we just imagine for a second that our warm water bottles are our patient, she will lay in the middle, okay, and she'll have warm air circulating around her for the surgery procedure.